trying not to. Okay, that's good. It's separate. Yeah. Okay. So, all right. Here comes the whip. All right. Just pass it. Thank you so much.
Maybe on the other side. Yeah. Okay. All right. I know. I'm gonna see.
I'm gonna take out my certified troublemaker sunglasses and call this press conference together. Come on in. I love the little lobbyists. We just heard the great story of how they get their name. Let's come on in and I'll join it. This is not your first press conference. Okay, good afternoon, buenas tardes, and thank you. Buenas tardes, and thank you for joining us today. I'm Teresa Leger Fernandez, and I have the great, I don't know, it's just the great joy of being able to be chair of the Democratic Women's Caucus. As you know, today marks the day we are going to be 97 women strong when we swear in Representative Adelita Grijalva, whose voice will continue to be heard through Congress, and it will be joined by her vote, and it will be joined by her signature as the necessary signature to release those Epstein files. And the reason we need to release those Epstein files, as we saw today in the news, there is a lot of information that is being hidden. And anybody who thinks that they can protect pedophiles should have a second thought coming, because the Democratic Women's Caucus and the Democratic Caucus and those of our Republican colleagues who know it is not right to protect pedophiles will be voting to release those files. And the real other reason we wanted to gather today is because we are here to vote. We're here to vote Senate vote sent over, because it does not lower costs, it does not protect SNAP, it does not ensure that the premiums for millions of Americans do not go up. But the other thing that they're doing in the Senate already is they are actually saying, no, we're not going to actually vote for the Affordable Care Act tax credits unless you insert abortion restrictions. Imagine that. They now want to restrict abortion as the price to pay for affordable health care costs, and the Democratic Women's Caucus joins every one of our colleagues to say, we are not letting you take away a woman's right to decide what is best for her and her family in consultation with her faith, her doctor, and those she loves. In contrast, Democrats today are introducing a bill to extend the Affordable Care Act tax credits for 3 years so we can save health care for cancer patients, for women, for families across America. Yeah. And that's why in the Rules Committee last night, I fought and voted and called on the Republicans to vote for the amendment that was introduced by Whip Clark and our leader Jeffries that would have extended the ACA premium tax credit so families are not slammed by catastrophic premium hikes. Every single Republican voted against that amendment, but let's see what Republicans do when we require that they vote to extend those tax credits for all Americans. I also wanted to bring up, and so many of us fought last night, about the need to feed the hungry families. We know that it is often the women who are showing up at the food banks, the women who are showing up and using their dollars that they get through the SNAP and nutrition programs to feed their families. And it is outrageous that Trump would have used hunger as a political tool. And we fought last night in the Rules Committee to make sure that hunger would never be used as a political tool again. And we are going to always be fighting to make sure that Americans don't go hungry, that Americans have affordable health care, that Americans are placed first when we think about our policies. Republicans refuse to join us in a fight for any of that, even though the majority of people who receive SNAP benefits, the majority of people who receive the ACA tax credits live in districts that are held by Republicans. It shows you that Democrats fight for health care for every American, regardless of whether you voted for us or not. And now I want to turn it over to somebody who is always fighting for the women of America to make sure that they have the health care they can afford and they deserve. Representative and Whip, Catherine Clark.
Thank you. Thank you. Oh my goodness.
Massachusetts.
That's right. The Commonwealth is in the house. I want to thank Teresa and all my DWC colleagues. Teresa, your leadership is a joy to us. So, so proud of all of us for standing up and speaking out and fighting for a budget that is worthy of America's women and families. Meanwhile, over at the White House, what have they been up to? Between remodeling a bathroom and building a new ballroom, they also issued a warning over birth rates. They are surprised that they are dropping, and they consider this a national security threat. But what is the response from the House GOP after their 54-day hiatus? They are voting to make it even harder and more expensive to support a family. They are voting to double, triple, and even quadruple healthcare premiums after they already voted to take $1 trillion away from Medicaid, a program that covers 40% of births of children and of disabled Americans in this country. So ask a mom anywhere. Ask caretakers anywhere, and they'll tell you this is a catastrophe for working families. And while Republicans were out of town, Democrats met with Mariah. Mariah Plant is a small business owner from West Virginia. She is going to be hit twice by this Republican budget. She is the loving, devoted caretaker to her brother, Matt. Matt is legally blind. He has nonverbal autism, and it's thanks to Medicaid that Mariah is able to provide the care that he needs and be able to care for him surrounded by his loved ones. And it's at the same time, Mariah is able to get her coverage under the Affordable Care Act. It's thanks to the ACA that she can run her own business and be able to take care of Matt. Republicans already voted to dismantle the program that allows her to keep her brother home, and now they're going after her coverage as well. Today, they're voting to double her premiums. She told us, that's a devastating hit for working people like me. There is not one good thing in this bill for West Virginia. Mariah's story is the story of women across this country. And what are Republicans doing? Affordability is the crisis of our time, and they're hiking premiums on their own constituents, taking home care away from disabled Americans, taking maternity care away from pregnant women, and taking doctor's visits away from children. They are doing this to the people they represent, people who voted for them, who voted for Donald Trump, because they promised to lower their cost of living. I don't know if Republicans thought they could just get away with breaking their promises, but last Tuesday made it pretty clear that if that was their bet, they're dead wrong. House Democrats are here to fight for the dignity and affordability and financial security that women and all Americans deserve. And you better believe we are just beginning this fight. And there is no one better to have on our side than one of our newest members coming from the Pacific Northwest, Emily Randall.
I'm so grateful to be here with my colleagues from the Democratic Women's Caucus who are inspiring champions, who bring the voices of their constituents and people across this country to the center of our work here in our nation's capital. For 43 days, 43 days of a Republican government shutdown is ending with the demolition of an already struggling healthcare system. Americans across our country deserve a government that works as hard as they do. While some of my colleagues on the other side stayed home, I was here in DC with my Democratic colleagues fighting for a solution, a bipartisan solution to end the government shutdown and to save healthcare. And when we were in our districts, we were listening to the stories of women and families and Americans all across the country. I've heard from hundreds of neighbors who shared personal experiences, federal workers who are hurting, people losing Medicaid, Medicare, Affordable Care Act coverage, and families who are struggling to put food on the table because of this Republican shutdown. One example of these stories comes from a constituent named Jessica. Jessica lives in Port Orchard, a family of 4 with a husband working for the Department of Defense. He's a civilian employee at Bangor, and this Republican shutdown has caused huge financial worries, not just for her family, but for many families in the area. Like so many others, they have been struggling with skyrocketing grocery bills and gas prices. But despite needing the government shutdown to end as soon as possible, they have shared with me the importance Jessica and her family wouldn't be able to afford health insurance. On behalf of the 27,000 federal workers, 115,000 SNAP recipients in my district, and on behalf of the millions of Americans across the country who stand to lose their health care, today, I will be voting to protect health care across Washington 6th and across the country. And I urge my colleagues on all sides of the aisle and from every state in this nation to join me and vote no. I now am honored to introduce Vice Chair Sykes, another powerful woman. I'm so thankful to serve with. Thank you.
Thank you, Congresswoman, and thank you all for joining us today. My name is Amelia Sykes. I am the Congresswoman representing Ohio's 13th Congressional District in Northeast Ohio. And I would also like to thank my dear colleagues of the Democratic Women's Caucus and the storytellers who are joining us today for continuing to raise awareness about the devastating consequences of the Republican healthcare crisis. I've been clear that any deal that would earn my support needs to lower costs and keep healthcare affordable and accessible. Our local economy in Ohio's 13th district relies on healthcare not only for our well-being, but for jobs and economic growth. This so-called deal does not get us there. It leaves thousands of my constituents without healthcare and spending more money to live than ever before. In my district, healthcare systems are the largest employers, supporting roughly 30,000 jobs. Families rely on these hospitals for care and economic stability, and Republican policies are putting both at risk. Slashing Medicaid and refusing to extend the Affordable Care Act premium tax credits are extreme tactics that threaten Ohio families. 32,000 people in my district get covered through the ACA marketplace, and 29,000 of those 32,000 depend on these tax credits. Without them, premiums are rising as open enrollment provided a sticker shock of epic proportions. Americans are going to be forced to pay thousands of dollars more in premiums, deductibles, and copays. This so-called deal restores SNAP and WIC funding, but these programs should have never been touched. And adding insult to injury, Republicans already slashed billions of dollars of food aid earlier this year in the One Big Ugly Bill. Ohioans sent me to Washington to make life more affordable, not more expensive, to expand access to health care, not take it away, and to help families put food on the table, not allow children to starve. I will not support a funding bill that fails to care for my constituents. I will keep fighting until Ohio families can count on affordable health care, good paying jobs, and a government that works as hard for them as they do every day. Thank you very much for being here, and I will now turn the program to my fabulous
Vice chairs from Michigan and Ohio. We have fun. Apologies for the curse word. I'm Congresswoman Hillary Skolton, proudly representing Michigan's 3rd Congressional District. Thank you so much for taking the time to join us here today as we talk about the most important issue facing our country today, and that is the affordability crisis that is crippling the American economy. Behind me stands a building of symbolism and incredible purpose. We who have the awesome authority to work here get to make choices. What we do is a business of making choices. The Constitution empowers us with the authority to make choices on behalf of the American people, to decide how we will tax them and how we will spend those taxes. Our Republican colleagues have made clear who they prioritize: billionaires, bailouts for foreign farmers, never putting Americans first. If you've been here covering the press conferences of the Democratic Women's Caucus, you know who we prioritize. Every single one of us tells stories of our constituents who are suffering because of the policies of a Republican-led Congress. They would rather slash health care away from millions of Americans than reopen the government. They use starvation as a tool to try and extract even more pain and take away even more from an already crippled healthcare system. Listen to the stories that we tell of our constituents and that the incredible storytellers who have joined with us here today to share their own stories. Listen to what they have to say and who we are centering at the heart of this fight. Earlier this week, I got a call from one of my constituents in West Michigan. Jim works for a local school district in Grand Rapids. He just found out that health insurance for his family is about to go up $184 a month. And that is not even on the highest side of health insurance premium increases. And even still, Jim wrote to our office saying, I don't know how we are going to be able to afford this. That's almost an extra $2,500 every single year. And that comes on top of already skyrocketing prices. Jim's story is one that we are hearing over and over again. As I came out to Washington this week, my inbox was full of people begging me to continue fighting. I'll proudly be voting no on this bill today. Constituents like Jim and all the others that you will hear from today. Thank you. It is my honor to now turn it over to my incredible colleague from California, Norma Torres.
Thank you, Hillary. Thank you. Good afternoon, everyone. I'm Congresswoman Norma Torres. I represent the 35th Congressional District in California. Let me be clear. We do not negotiate with terrorists. This Senate bill is a direct attack on hard-working families, and shame on our U.S. senators who surrendered our hard-earned benefits for what? 54 days House Republicans have been absent while families continue to struggle. The president has spent the entire year refusing to meet with Democrats, fully aware his own party holds a very slim majority. In the past, we have compromised on issues that we deeply care about. But this is the last straw. We will not allow the hardworking earned benefits of our constituents to be ripped away. The attacks on healthcare have been relentless. This administration and House Republican leadership have slashed the Navigator program funding by 90%, gutting the program that helps Americans find coverage. They blocked the extensions of enhanced ACA subsidies. They gutted Medicaid through caps, work requirements, and bureaucratic hurdles. They love bureaucracy for the people. They hate bureaucracy for their billionaires. They've expanded non-ACA compliant plans, and they've ignored protections for pre-existing conditions. In total, Republicans have tried more than 70 times to repeal, weaken, or destroy the ACA. This is a sustained, coordinated attack on millions of Americans' health care and security. I have spoken with seniors, veterans, and families across the Inland Empire. They are scared, they are anxious, and they are angry. And yesterday, I met with veterans who gave me my marching orders. Congresswoman, fight on. This is too important for our communities. They know that without enough medical personnel, insurance means zero, nothing. We will not allow partisan games to decide whether a woman gets care, a child sees a doctor, or a senior or a veteran can afford their medication. Today's vote is about protecting health care for millions of Americans. And I refuse to allow a single family go without care they need to survive. And for California, Prop 50 gave us our marching orders, and we will not surrender. And now I have the privilege of introducing a leader and a fighter for all humanity, my colleague, Representative Presley.
Good afternoon. Grateful for the leadership of our chair, Teresa Fernandez. Grateful to all of my sister colleagues. I live by the ethos that the people closest to the pain should be the closest to the power, driving and informing the policymaking. And with our storytellers and in my sister colleagues, we demonstrate that because women have always been the closest to the pain. We have always disparately bore the brunt of whatever society's ills or hardships are. Policy negligence, policy violence. The closest analog we have to this moment is the pandemic, which was wholesale harm. And we know that there was a she-cession there. There were more women pushed out of the workforce than there were men. So we always bear the brunt. But we are also always on the front line of the fight to defend everyone, and the fight forward. And today is certainly no different. So we're all here because we are doing what women do, which is give a damn. Give a damn about our families, our neighbors, our communities. Women always show up to remind us of our shared humanity in moments of consequence. And today it's the Democratic women in the House. I promise you, if every member of Congress had to walk one day in the shoes of our dedicated federal workers, or a parent struggling to get their kids food and keep the lights on, this shutdown wouldn't have lasted a day. Our Republican colleagues are as callous as they are clueless about the everyday struggles of people. We know that there is no deficit of resource, only a deficit of empathy. 60 senators wouldn't have signed off if they knew what it was to walk in our shoes on the false choice between people's food, their paycheck, and their health care. Hungry mothers and fathers wake up every day in this country and scrape together breakfast for their babies while they go without. They wait for the bus, hoping that they have enough fare to get on it. They go to work and clock hours, sometimes a second or third shift, and still they can't make ends meet. I think Republicans know exactly what they're doing, but maybe, just maybe, they're so out of touch they didn't realize what they were doing when they stole food from hungry families and sent healthcare costs soaring. Do they know what happens when someone opens the mail and sees their insurance is about to double? There are no bootstraps to pull on. There are no belts to further tighten. They will go without health insurance. They will put off preventative care, and they will pray that they don't end up in the ER. Recently, a constituent in the Massachusetts 7th shared her fears with me, Paula. Before the pandemic, Paula and her husband could afford their premiums. It wasn't easy, but they made it work. Then her husband lost his job and their insurance, and the Affordable Care Act became their lifeline. It carried them through years of uncertainty while she took on the role of his caregiver when he became ill. Now she's worried that the coverage that once saved them could soon be out of reach. Each year, she feels that lifeline slipping a little further away, and she's fearing her family will go bankrupt. Our government should provide basic goods and services. Government shouldn't abandon people, and it shouldn't take the rug out from hardworking people who fought so hard to get an even footing. None of this, here's the rib, is naturally occurring. This is the result of intentional, cruel policy choices, but it is not too late. Today, Republicans can commit to actually addressing this healthcare crisis that they created. Today, Republicans can tell the White House to stop playing games with people's lives, with basic healthcare for children and families. And we will not let up. Healthcare is not a nice to have, it is a must have. It is a human right. To each of my constituents, to each of our neighbors, to each of our dedicated staff members, to the federal workers who are reeling from the uncertainty and cruelty of all of this, the hurt and harm you are experiencing is undeniable. And so too was this moment 100% preventable. And that's what makes it so unconscionable. We're going to keep fighting for you every day, inviting decisively, hell no, because that is what you deserve from your member of Congress. All right, and now we'll hear from our chair emeritus, Speaker Pelosi.
I will pick up, Congresswoman Presley, I'm going to pick up where you left off. The public deserves better than this. As you said, as our distinguished leader, Mr. Jeffries, said on the steps of the Capitol an hour or so ago. Here's how we got here. For 100 years, presidents have been trying to pass health care for all Americans. Barack Obama succeeded with a Democratic Congress. Since then, the Republicans, right immediately following that, they for 60, 70 times tried to overthrow it, saying repeal and replace. They had no replace because they do not share our values. Our budget is a statement of our national values. What is important to us as a nation should be reflected in that. They do not share the value of health care for Americans. What they share is the value of giving tax breaks to the richest people in America instead. It's not cruel. Cruel is almost a gentle word to describe how vile their policies are. I do believe as a mom that food is medicine. At the same time as they are heaping burdens of cost onto families for medical care, for health care, they're also depriving families. Imagine that the President of the United States is appealing to the Supreme Court to not make him feed the poor. How do you describe that? Demonic? I don't know how you describe that, but the combination of lack of concern for the needs of the American people is something that we want to be sure that every constituent knows and tells every member of Congress, especially those on the Republican side who don't seem to be aware. Now, just one more thing. I said we passed it, and you know that. But then when they tried to overturn it again, when they had the majority in the White House, 10,000 events were held across the country by people telling their stories, and that your stories are the most powerful, eloquent weapon against what they're doing. My baby was born with a heart condition. Another, my wife has breast cancer. Another, my father had a stroke. Another, my brother has disability. Whatever it was, 10,000 events with many more, of course, stories per event. That was what really strengthened our hand, and of course, the hand of John McCain saved the day then. But they're at it again, because we come right back to that budget. Rather than feed the children and seniors and those who need food stamps, who are hungry in America, they want to give a tax break to the richest people in America.
rather than giving food to children the night before on Halloween night. Their trick for the children of America was, we're going to make sure tomorrow we do not have to obey the law. I know that law. I know that law well. I wrote that law. He signed it. That they are supposed to feed people even during a shutdown. Happy Halloween. The tricks on the children, on the seniors, and others who need food. So that's a health issue too in our country, but it's a values issue. It's a value issue as to how we meet the table needs of the American people. And again, as I say, nothing is more powerful than the beautiful, exquisite stories that people tell. I heard Ayanna, Congresswoman Presley tell that story. We all have stories of our constituents. And today we have our special guests heard their stories yet? I'm going to yield back to you, Madam Chair, to yield to them. Thank you all for sharing your stories. Thank all of our House Democrats for being so loyal to the American people, because they know, as Congresswoman Presley said, the American people deserve better. Thank you.
So I think that what we'll do is, Representative Chu, do you want to maybe introduce the story?
We have some incredible storytellers here. And there is a group called the Little Lobbyists. They are a group of mothers and children who came to Capitol Hill to tell their stories, and they got a meaningful name, Little Lobbyists. And so now I'm happy to introduce Victoria Shiano, a champion in the fight for health care at Little Lobbyists. She will share how the ACA tax credits impact her own family and all the families at Little Lobbyists who are juggling care for children and people with disabilities. Thank you for joining us today, Victoria.
Thank you, Victoria.
Thank you. Thank you, Congresswoman. It is such an honor to be here today to share our stories. My name is Victoria Shiano, and I am from Chester County, Pennsylvania. I'm the National Community Engagement Coordinator for Little Lobbyists, an advocacy group fighting for all medically complex and disabled children and families. More importantly, I am mom to my 9-year-old son, Cole, a mischievous and adventurous third grader who is currently working on multiplication tables in between yelling 6-7 every 5 minutes. Cole also has mitochondrial disease, a rare disability that affects his entire body. He needs a permanent IV in his heart to deliver nutrition, feeding tubes, blood sugar monitoring, seizure precautions, 36 doctors, 4 therapists, and 20 hours a day of skilled nursing to be home in his community and school where he is thriving. My family relies on Medicaid and the ACA to be able to obtain the necessary care he needs. I am here today on behalf of all medically complex and disabled children in this country and their families for an urgent and immediate call to action. Congress must wake up and listen to their constituents because rising healthcare costs are a crisis. With cuts to Medicaid and the loss of ACA subsidies, families across the country are about to experience painful economic situations and may be faced with some horrific choices. A family from North Carolina just shared a story with me about how they're having to sell their home and live in an RV in order to try to pay their new premiums, which are rising over 45% next year. Their trach and vent dependent daughter will now need to receive ICU level care she needs in an RV while her parents try to make ends meet so she can continue to live with her family where she belongs. As costs rise, fewer people can afford care. Hospitals and clinics have to reduce services or shut down. We also have another family in North Carolina who told us their daughter's PT clinic is closing next month due to the Medicaid cuts. They will have to drive over an hour now to seek care from a new provider who doesn't know their daughter, and her whole care system will have to start over. Rising costs for some also mean bankruptcy. With the Trump administration reversing a rule that would have left medical bankruptcy off credit reports, families who declare bankruptcy due to medical debt will experience severe long-term impacts. We have a family in Louisiana going through medical bankruptcy right now. Their almost 2-year-old son, who has Down syndrome, and his mom and his dad are an incredible family. His mom is a lawyer, and his dad is his full-time caregiver, while also working every side hustle he can find to try to make ends meet. They were still forced to destroy their credit and give up everything to declare bankruptcy just so they can keep their son at home where he belongs. When your credit record is ruined, it closes off housing opportunities. If they ever need to move, they may not be able to rent or buy a home because of this mark on their credit. Poor credit also impacts employment. A mom was recently offered an incredible opportunity that required security clearance. Despite her decades of experience and stellar record, her credit score is the reason they ended up needs in order to pay for the life-saving medication her medically complex son needs. These families reflect a healthcare crisis that will impact every American, regardless of their financial status, as costs spiral out of control. This is life or death. Healthcare is not a privilege, it is a right. We refuse to allow our children to suffer and die so Republicans can give handouts to billionaires. We're warning you about a disaster that will affect every American. You need to listen to your constituents and fight for a world where no mom has to skip dinner so her child can eat, where no dad never gets to see his children because he's working a burden when they hear their parents talking about medical bills. Thank you.
Thank you so much. So the Democratic Women's Caucus recognizes the importance of care we give to our children, care we give to our elderly, and those people who care for the people who care. I'd like to introduce our co-chair of our CARE Task Force, Brittany Peterson.
All right. Thanks, everybody. It's such an honor to be able to stand alongside all of these incredible women who are fighting for working families here in the United States, especially when I have these moments where I can't believe I get to stand as a colleague of Speaker Pelosi, having watched her for decades as a champion for families, and everything that she led with was always for the children. We are doing this for the children, and she continues alongside you. Oh, she left. So I am here as a mother, a Coloradan, and as a representative for Colorado's 7th Congressional District. In Colorado, up to 75,000 people are expected to lose access to healthcare because they are no longer able to afford it because of these because we did not extend these premium tax credits. What that means for working families in Colorado, it is the small business owners who are no longer able to afford health insurance. They're employees who don't have access to health insurance at work and rely on these subsidies. When I think about the hundreds of stories that we've heard from across Colorado in my district, I think of Brian, who lives in Salida, who's a teacher who does not get health insurance through work. He has an illness that it is life or death on whether or not he is able to afford this. His premiums are going to go from $600 a month to $1,800 a month. It is simply unworkable for him and his family. They don't know what their future is going to look like and how they are going to be able to make ends meet. When I think about the mother who is no longer going to be able to ensure that her son has access to the cancer treatment that he needs. I think about my high school friend who reached out devastated with the deal that went through, not the deal, what happened in the Senate, that we had people that caved, that didn't stand strong alongside her and others. She knows that this is life or death for her in her fight to ensure that she gets the care that she needs. So I'm here. I want to acknowledge that the devastation that people feel right now, that we were unable to secure these extensions, but I want you to know that this fight is not over. We are going to keep showing up and making sure that people hear your stories. How we make a difference in a Republican majority in the House and the Senate and the presidency that is unwilling to put the working families first and their billionaire buddies are their number one priority. We need to tell your stories. You need to reach out to your members of Congress to talk about the impact that this is going to have in your ability to get the care that you need. But it's not going to just impact people who rely on these subsidies to get care through the ACA. When you have people who 75,000 just in Colorado alone who are going to be unwilling to pay for their health insurance, we're going to have to opt out. These emergency visits don't go away. These illnesses don't go away. And it shows up in emergency room visits with exponential costs that are going to fall on the rest of the market. So skyrocketing costs are coming for the rest of us. This is the Republican healthcare crisis that they have created, that they have been unwilling to address, to work together in a bipartisan way. And that's why we are standing strong alongside each other to fight for the families who desperately need a voice here in Washington. So thank you all for being here. Thank you to the leadership of this caucus. I know that we have amazing storytellers who are going to talk to us about what this means in their life. And so if you want to tell me what to do next.
It's Brittany. We heard from Representative Pedersen, we heard from Speaker Pelosi, and we heard from our first storyteller, Victoria, about the importance of everyday Americans sharing their experiences. It's what passed the Affordable Care Act in the first place. It's what got landmark legislation like finally reaching marriage equality. It is what changed the shape of our country when regular people tell their stories. And I'm so honored to introduce Lily Combs, who is here from Virginia, another incredible patriot, an incredible neighbor, an incredible person who is using her individual story and her pain to advocate for neighbors across the country. Thank you so much for joining us, Lily.
Lily!
Thank you. Good afternoon, and thank you to the Democratic Women's Caucus for having me today. Thank you, everybody. My name is Lily Combs, and I live in Fairfax, Virginia. I currently pay $165 per month for a gold plan through the Affordable Care Act. If Congress takes away these tax credits, my insurance is going to go up to $243 a month for a silver plan. I have it right here for everybody if you want to see those numbers. That's over $900 a year. And the deductible is going to be $1,600 more than my current deductible. This also comes as I fight a rent increase. And I know I am just one of hundreds of thousands of Virginians who will face tough choices, and many will drop their entire health plans. This feels like a death sentence for so many people. I had good, I'm going to put this down now. I had good employer-based health insurance in 2 other jobs, but sometimes life gets in the way. I am a single mom who worked for 10 years for a federal contractor, but left that job in 2016 to help care for my aging mother, who was a widow, while raising a then middle school age daughter. COBRA was very expensive, but fortunately, I qualified for Medicaid, which allowed me to have health insurance while I cared for my elderly mom. In 2018, I returned to work full-time and got a job at Amazon Fulfillment. in Sterling, Virginia. I had good health insurance, but I left that job in 2020 to finish to work on my deceased parents' home to rent and help my then teenage daughter dealing with a pandemic mental health crisis. Again, I'm a single mom, and my daughter needed me. I then had income from renting my parents' home after they died and working part-time in retail. So then I made too much to qualify for Medicaid. Fortunately, the Affordable Care Act was an option for me, and I have been on ACA affordable health care ever since. It paid for a surgery I needed a year ago, and I don't know what I would have had done without the Affordable Care Act health insurance. I am worried about what will happen if I can no longer afford health care. I do not have enough hours at my current job that I work health insurance. I am 57 years old. I am getting older, and I am worried about all the health problems that might arise for me in the next 8 years before I can qualify for Medicare. I am also worried about my 23-year-old daughter and my 2-year-old granddaughter. My daughter can stay on her dad's insurance until she is 26, thanks to the Affordable Care Act. But I want these tax credits to be available to her when she ages out of his plan. I have always worked hard, but many people, especially women, have to take a career pause for caregiving responsibilities. I'm a part of that sandwich generation who left a job to care for a parent and while parenting a child. Medicaid and the Affordable Care Act made that possible for me. Since young adulthood, I have lived with anxiety, depression, and take Paxil for my own mental health. Additionally, I am currently trying to get all my preventative appointments in. My mammogram, my physical, my colonoscopy, because I don't know how long I will have health care. So I will close this thought. I had good insurance working for Jeff Bezos, but Congress should not take away my health care in order to fund another tax break for billionaires like him.
Woo! Woo!
And we should definitely not be sending billions of dollars to bail out Argentina while taking away Americans' health care rights. Thank you to all the members of Congress who invited me to speak today. And a special thank you to my local Congressman, James Walkinshaw. He's not here today. And thank you for everyone fighting for health care. Thank you.
Thank you for telling that story. We want to thank everybody, and now let's go swear in Adelita Grijalva.
You were so good. First time for me.
Pictures.